In this video, we're going to be talking about the reason why we have higher healthcare costs. And since we've, in the past, we've kind of gone over in a basic sense, discussing the reason why pharmaceuticals are at higher costs because of the intervention of the federal government from the aspect of the FDA's intervention to slow down the process of drugs and limit the amount of competition on the market as of a way of protectionism. We've, which has obviously raised the cost of drugs on the market, and we've already kind of gone over that idea. And if we were to go to actually just an efficacy, eliminate efficacy from it and only go over safety and have that be done by a third party group, that we could get this done a lot, not only faster, but we could get that done quicker, that it would actually be to the benefit of the people. But and it would be cheaper for the companies themselves to bring drugs to market, which would make it a lot cheaper for them to produce the drugs for the people. Now, we've already gone over that kind of basic idea. That's why when we see these things with it, they've become more costly. Now, when we see and we've already gone over that idea and how the executive order with Trump, when he did that, how that was going to actually negatively impact the prices of pharmaceuticals, because it was going to limit their offset through offset of international sales, which is going to add to the prices to the consumers. Now, when we start to look at but the overall cost of healthcare is where people end up getting concerned. It's not that people get concerned with the actual pharmaceuticals. Pharmaceuticals are just a small fraction of healthcare costs. Healthcare costs are mainly in when they visit their doctor, their regular doctors, when they visit specialists, and then when they're visiting when they have to go into the hospital. And that's the thing where all of these things of regulations on these other healthcare providers have become very, very troubling. And that's where these ideas of certificate of need laws have basically harmed the whole market. Now, if we now these were basically initially was the first one to actually establish it was New York in '64, and then by '74, with the federal government joined in an effort to require states to to basically set up these certificate of need requirements. Certificate of need are basic that's to receive funding from federal programs. Now, basically, is they're trying to restrict the amount of hospitals so they don't become unprofitable. Hospitals and other providers so they don't become unprofitable, and the idea is you're not going to have the people cross over into certain other areas for doctors. You're not going to have competition. Everybody's going to stay out of their areas for competition, in theory. Well, that's not how things work. And the fact is even in '87 they recognized the program to be a failure. We've only seen a few states actually retire their program, and this is a thing with it where we've seen problems in which it's really restricted a lot of access, and it's shown on it's shown where people have had, as we've seen, as we've added on essentially since then, the ACA, it's eliminated a lot of access to a lot of providers, because a lot of providers have lumped together and a lot of providers have left the actual thing. And it's basically has lumped everything together, which means that you're going to have less providers, and they have not accommodated for it, because obviously you need to go to these state regulators. Now, even if your state does not have these, in many if your state has been one of the ones to do this, in many cases a local jurisdiction will make a decision on whether this medical group can put up a new medical service in their area, such as if a doctor can come in and all these other things, if they can do that. If a doctor group can be established in their thing, whether they can add a new thing for an ambulance service can come in and establish a new ambulance service, and all of these things. And their whole thing was basically the whole theory of it in the start was, oversupply would lead to increased costs. Well, that's the exact opposite. Oversupply would theoretically, first of all, eliminate the poorest of the competitors, and essentially once you maximize supply, it would lead to your lowest possible costs. All it would do is it basically would cause the failure of your worst possible medical providers. In this case, with it, what it does is it ensures that the worst possible medical providers cannot go out of business. It protects them from that. And that means people who live in these poor areas cannot get access to quality health care. They're always going to maintain poor quality services, because they're always going to have limits on, obviously, their what medical services they can get, number one, and number two is the quality of the providers are never going to get any better. And this is the whole thing. And when it comes down to it, it's even when it comes down to the machines. If they want to buy more beds, more MRI machines, more CT scans, they're limited to these things because they have to go to the state regulatory board to actually ask for that. And when we've seen the actual reduction in these things, we've seen reduction in quality of care. And we've seen also through the ACA. The ACA was something that caused a lot of people, because they did not like the added-on regulations, because they'd rather just care for their patients and focus on that rather than an immense increase in regulations. That caused a massive change in how things were. Now, what that meant is essentially you had a lot of people leave and a lot of things come together, which means there's going to be less providers. They did not accommodate. They never accommodated, which meant basically all people did was it raised the level of consumers to providers. This meant that basically when they promised that under the ACA that it was going to have a reduction in cost, it couldn't possibly have a reduction in cost, because you have less providers, more consumers. This means you have higher demand, lower supply. That's going to cause a massive increase in price. If you want to decrease price, you need more supply and less demand. When you lower demand, obviously you're going to you lower price. When you raise supply, you lower price. The only way you can actually do this is actually to convince these states to actually eliminate these regulations of certificate of need and basically allow someone to actually go in there and say they're free to do these things, free to establish whatever they want to create a medical, whatever medical provider wants to establish something with it, let them do it. It's at their own risk. And say that what I call it, state regulators or even local your local business people with it do not have any implications on it. They're allowed to build with it whatever they want, no different than any other building, as long as they're building to code. And once they acquire the land with it, they're free to build with it, free to use it whatever way they want. Not have aldermen basically voted down because they believe it would negatively impact a local hospital. Not have state regulators decline a certificate of need for the same reason. Now this is where the whole problem comes from. They've essentially done this to block competition, and this is your local level of cronyism, and that this has gone on for decades and decades. And if people want to know where their price is going up, now prices don't always go up through that point. It's also when you go into the hospital. Our hospitals aren't like other hospitals around the globe. When people say, "Oh, but if we I've heard the argument from people on the left. Oh, if we go to single payer healthcare, we can cut down costs." That's not the truth, because what our hospitals do that other hospitals around the globe don't do is our hospitals end up being a full service facility. This is completely different than other hospitals around the globe. Other hospitals around the globe offer far less services than what we do. They're not offering all the services, such as they're not offering food, they're not offering the nutritional services, they're not offering extra doctors beyond the actual, they're not offering the doctor services beyond, a lot of times they're not offering the doctor services beyond the surgeon. They're not, we have the doctor, we have our doctors, the nurses, the caretaker, the other staff. We have the caretakers. We have we have on top of that, we have the nutrition. We'll have a nutritionist. We'll have the food. We'll have the pharmacist. We'll have the pharmacy. We'll have basically the and then we'll have like the surgeon, and we'll have all these things together with it, and it raises a cost that is astronomical. Because in other countries, when people do medical travel to the Philippines, which have just as high quality service for surgeries, they're not having the same. They don't pay for. They don't have their stuff set up for feeding the people, for getting their food there with it, nor do they have the stuff for nutritionists, nor do they have the stuff set up for the things such as the pharmacist. You have to actually pick up the medication. Now, it'll be administered, but you have to pick up the medication and pick up the food. And the reason why is because that's what ends up being a major cost. Now, if you look at our thing, is we don't do that. And if they end up itemizing those things with it, just the end up cost of what it ends up doing is it ends up dramatically raising the cost of the hospital bill, just because you're getting food on site. And that's one of the problems that we're dealing with when we're dealing with these things, and they're not doing that elsewhere. And the fact is we're having these things that are taking that are happening, and this is something in which that if you were working with such things as like a restaurant or restaurants in the area, which you can go to almost any hospital and there's restaurants always in the area, and there's they could provide the same thing, such as if they give you a dyed can of pop at a hospital, you can guarantee when that hits billing that's going to be astronomical. It's going to be the price of some of the most expensive bottles of champagne. But if you got that at a local restaurant, that's going to be like $1. If you would have called if you so when you start to look at those things, when you start to look at food with it, the food you can either get garbage hospital food at the prices that would be considered well above the finest restaurants in the world and the highest prices in the world for it, or you can get basic and a lot of times it's horrible, virtually inedible food, or you can get something at a local restaurant that would be sanctioned by a list prepared by a nutritionist that's already what it called that's off-site at that's already been sanctioned by your health plan. And what you can do, you can actually reduce cost. That's something where you can reduce cost, and this can actually help you out. And that would actually reduce costs for you. Now, what you would have with it is either A, they deliver, or B, your family picks it up, and then they give you the food with it, you eat the food, blah, 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 you're done. You throw it in the garbage, you're done with that. Now, that's far cheaper than if you were to actually have the hospital prepare the food. Now, people are going to say, oh, but then hospital employees are going to lose their job. Trust me with it, there's no actual valid number of the payment that ends up validating that amount of money. We're talking there's a lot of wasted money when it comes down to these things. And we can and what ends up happening, the reason why these costs are so high is because we end up putting them together, and because they're kind of put into an omnibus type of bill for hospital care, such as in I believe 2006 when I had my back surgery. The end up cost to the insurance company that they end up being billed at was $75,000. Now they end up working it down to several thousand dollars. But even without insurance, it's still $75,000, and it was still if I was without insurance with it, that would have been unbelievably expensive, even if I would try to work a deal with cash. And I mean that is so astronomically high. Now, if you do the same thing without insurance out in the Philippines, you're talking about 5% of the cost. Now, if you're willing to basically pay for food and for buy the medication elsewhere and get it done there, you can actually get the same exact surgery, because my future mother-in-law actually had the surgery near the neck with it of a spinal fusion, and paid and her daughter paid about 5% of that cost. And people are going to use the excuse of, oh, but it's because the amount of the money they make is out there is different. But still, even with that, if you even look at that with it, our levels should be far different in pay. Even with our levels being far different in pay, our costs should not be 20 times for the same surgery. And it's because we're tapping things that don't belong there. There's a lot of things that we're paying for that just don't belong, that have nothing to do with healthcare. And until we end this, we're not going to find that. And we have that, and we have other things such as the certificate of need, blocking competition. We're blocking competition, and we're doing this as protection, which is basically causing a a massive hike in the cost of medical care, and basically makes it so the poorest of the people that live in a lot of times the urban areas don't have access to any quality medical care. Because if we want to actually do something, we should actually start doing something about the quality for medical care. And that's where I'm basically going to end this, and that's about it, and bye everyone.